Hi, welcome to week 5, the nervous system. This video is going to give you some new information about a research study that shows some promise in the diagnosing of neurodegenerative diseases, specifically Alzheimer's and Parkinson's. I know you are aware of patients who have these degenerative diseases, and the only way to get a conclusive diagnosis of Parkinson's disease and Alzheimer's disease is through biopsy of brain tissue. This really is difficult to do in people who are alive, and usually the diagnosis is made after death. When I was researching Alzheimer's and Parkinson's disease, I came across this study that showed something different than what you read in your text. What you find in the text, the information is usually at least 2 years old. So this is very exciting. This is cutting-edge research. What the researchers reported at the American Academy of Neurology in their annual meeting this past April was a study that showed results of skin biopsies done on Alzheimer's and Parkinson's patients that helped determine the risk for the development of these diseases. What was detected in the skin biopsy was increased levels of an abnormal protein that was present in the biopsies from the Alzheimer's and Parkinson's patients, but not in the other subjects in the study. One of the limitations of the study is that it is a small study. Although it is a follow-up to a study that the researchers had done previously and shed more light on information that was obtained in the prior study, also using skin biopsies. This current study only had 20 participants with Alzheimer's disease, 16 participants with Parkinson's disease, 17 participants with dementia caused by something other than Alzheimer's or Parkinson's disease, and 12 healthy control subjects. The healthy controls were recruited from the caregivers and families of the Alzheimer's and Parkinson's disease patients. And the ages of these participants ranged from 62 to 85. What they found specifically was that subjects with Alzheimer's and Parkinson's had a particular protein, tau, that occurred in a rate 7 times that of the other participants, such as the healthy subjects or the dementia subjects. There was also a protein that has been identified previously that has a strong association with Parkinson's disease, this alpha-synuclein protein. In this current study, they found that this protein occurred in the Parkinson's patients at a rate 8 times higher than in healthy participants. In this researchers' prior study, they found that this alpha-synuclein protein didn't show up in healthy participants at all. In this study, it occurred at a rate 8 times higher than that of the healthy participants. So there is some significance there. What are the implications for practice? This is a small study. Obviously, more research needs to be done. These researchers, and I will provide the reference at the end, these researchers are making this a priority for their efforts to help Alzheimer's and the Parkinson's patients. Obviously, a skin biopsy can lead to earlier diagnosis. You have an earlier diagnosis, you can provide earlier treatment. You can minimize and possibly prevent disease progression. You can provide counseling and psychological support for the patient and the family earlier in the process so they can prepare themselves and the family members for what is to come. They can allocate their resources in such a way that it is beneficial to the patient now and in the future. Also, earlier diagnosis and further research can show promise for discovering and developing medications that can hopefully prevent progression and maybe even prevent the diseases. So when you're dealing with your Alzheimer's patients and your Parkinson's patients, there's hope on the horizon for earlier diagnosis. And a skin biopsy is certainly much less invasive than biopsying brain tissue. This is the reference. There's a press release that was put out in February of this year by the American Academy of Neurology. I went to the proceedings of the meeting that they had, the American Academy of Neurology had in April, to review the actual presentation of these researchers. So this is just a little bit more information that you can use in the future, especially if you have an interest and you work with Alzheimer's and Parkinson's patients. Thank you for your time.